All right, welcome everyone. We are going to get started momentarily. Let's just give everyone an opportunity to join as people are coming in. All right. I think we can start. If we have some additional people coming in, I'm sure you'll be able to catch up. Diane, you can start the slide deck. So with that, I'd like to welcome everyone to our first ever joint information session for MedTech Innovator, BioTools Innovator, and California Life Sciences Fast program. So I'll briefly mention what we're doing here, what we're all doing here together today. So really both organizations, MedTech Innovator and California Life Sciences, we're both here on the same joint mission to support innovators and innovation in healthcare throughout the different verticals, throughout the different stages of development, and are really here to complement each other in supporting you, the innovators. So this is all about you. We're here to tell you how we can help. And this is why we're joining hands today. So today with us to talk about this, I'm Ayelet Morom. I'm the program director for BioTools Innovator. I am joined by Diane, the program director for MedTech Innovator, and by Sibili, the executive director of innovation and entrepreneurship for California Life Sciences. We are also very grateful because we are joined here today by two of our alumni for our respective programs, Patrick and Wesley. You'll hear more from them later, so I won't go into details about any of them. You'll hear much more later. So let's start. We'll kick it off with telling you a little bit about the California Life Sciences Fast program, and I will hand it over to Sibili to introduce the program. Hi, Sibili. Thank you for being here today.
Trying to find the mouse to get off mute, sorry.
There you go.
Welcome, everybody. I'm excited to talk to you today about our open application for the California Fast track for med devices, diagnostics, and biotools like organoids. So I would like to start out to tell you a little bit about who California Life Sciences is. So we are California's most impactful life science or membership organization, and we work to shape public policy, improve access to breakthrough technologies, educate lawmakers, and advise equity within California ecosystem. But most of all, we also act as a catalyst for disruptive innovations with high medical need areas through customized advisory programs like FAST. And we have a mission to focus mainly on first-time entrepreneurs, and we would like to bolster and accelerate these innovators and entrepreneurship ecosystem in California with our support and resources. Next slide, please. We have a few recent highlights. Yes, we also have a company who was mentioned in the recent Nobel Prize, which is Chasqui. I don't even know how to pronounce it correctly. Sorry if I mispronounce it. And we have Circularis, which had a recent exit with Ginkgo Bioworks. And one of the investors in Circularis was also at our innovation showcase recently. So they are happy about this. Syntex had a big collaboration, also a FAST alumni with 550 million value of deal value. Next slide, please. I would like to tell you a little bit about our 10 years of what we did with California Fast customized advisory program. So we have a very diverse profile, but as you can see on the right side, that we are have really a high focus on therapeutic platforms, but we also really focus on diagnostic tools and MedTech, and we will focus in 2023 even more on that side. You see on the left side regarding the early stage, and this differentiates us a little bit to MedTech Innovator. The FAST program likes to focus really on pre-seed and seed, some Series A. And I would also like to point out that 50% of our C-level and executives and founders are females in our program so far. Next slide, please. We also work with international companies. I do not want to go into details on that because right now our application for MedTech is really mainly focusing on California, but we have really a broad international, we work with accelerators across the world. Next slide, please. So what differentiates FAST and what do we contribute? And here is also where Wesley comes in as one of our alumni in the med device field. So we FAST is really a customized relationship-driven approach. It's team-based, and we tap into a advisor network we built over the past 10 years with our 102 companies who went through the FAST program so far. I would like to give Wesley a moment to introduce himself, his company, and maybe comment on this differentiator from his view.
Yeah, thank you, Sabella. And good morning, everyone. Really appreciate being here and getting to share our story. It's only been about a 2-year story, but we're well on our way. I'm the CEO of Jawad Neurotech, and we're developing a first-in-class device to access the surface of the brain without the need of drilling through the skull for the purposes of epilepsy surgery and neuromodulation. And we were a FAST 2021 cohort. And I think just the main message I like to get across is what a key role the FAST program played getting us going and out of the gate. To kind of give some context of what that means, like what gate were we in. In the fall of 2021, we were a pair of technical co-founders. I'm an engineer with about a decade of experience in industry. And I was teamed up with a physician, a neurologist, and inventor. I just completed my MBA at UCLA, and we're building this team and this venture out of the Biodesign Fellowship. So to sum it up, we had just learned to walk this entrepreneur path, which is where these communities and organizations really play a critical role. So, as many of you know, at this stage of your venture or ideation to building your company, there's really 2 key aspects to your success, or I would say, which is, your network and your advisors. And then second, the access to capital. So, you need to have somebody to bounce your ideas off of weekly, especially when you're getting things going. And so fortunately, we were accepted into the program after winning the MedTech Color Innovation Challenge. My founder, Dr. Jose Morales. We were paired up with these 8 outstanding advisors from across the industry. I'm talking legal, finance, marketing, engineering, business development, and what you get with that isn't just, these weekly touch points, which I can't stress how valuable that is, especially when you're, putting all the pieces together, facing new problems weekly. And then having that group to come to every week to give, their inputs, take it all with a grain of salt, but having that diversity of thought is extremely important. And coming with that diversity of thought is also a huge network, a vast network, and access to capital. So I'd like to say it's kind of like having your resources in your network quadrupled in size, which again is critical at this stage. And I'd like to also just add that, this team or this extended team really remains till today. We stay connected. I run into a problem and I know, Walt has the answer, and I message him and he answers. And even one of our advisors came in and participated in our initial round of fundraising this last year, which was really exciting. So the community extends way beyond the FAST program. I receive introductions to investors almost weekly still. Thank you, Sibylla. And we also were just sponsored to go pitch at Resi, which is huge for us and a great stage for us to get towards the larger check sizes. So that's it in a bit of a summary. I'll just hand it back to you, Sibylla.
Yeah, thank you. And you teed it up nicely. So before we go to the Access to Capital program, I want to just briefly, next slide, please, outline how FAST looks like. And I will answer the audience questions, which is a lot regarding the international audience here. I will answer it in 1 minute right after this. So we run this FAST program twice a year. And in fall and in spring. Our spring application is right now open until January 5. And please look at our website and click on or Google for FAST, and you will see the application details. We also have an application for female founders right now, separate to the MedTech track. And of course, we are looking for therapeutics continuously. So the program elements are that we have a 12-week program. We then match, we do a review process. So there will be investors, stakeholders reviewing your applications. We select the finalist. We have a kickoff showcase. We have a 12-week program with individual assigned advisors according to your goals. The CEO manages these meetings like he manages his board of directors. And then we have a final showcase where we also add investors to it. And so perhaps next slide, because this access to capital is really one of our key points for 2023. We will also add now a new program, and all FAST alumni and also those who become members who applied but might not have been selected, they are welcome to participate in this 5-module webinar. And this is just an outlook I want to mention, but I want to give Wesley one more chance to get a little bit more from his perspective, because we are doing it the first time that we highlight 8 of our FAST alumni at the upcoming JPM week. And we do that together with Resi. And I work with Resi since 2018. Just want to mention also the global audience here. If you can participate in Resi also virtually, and really the kickoff for fundraising is in January. If you are in a fundraising mode, you might want to evaluate that. And so now to the question of the audience, international audience. We usually work internationally either with government or with accelerators, because we are a nonprofit, and some of this we have to be, some of this is associated with fees. But if you have a subsidiary in California, or you are a CLS member in California, then you have access to this FAST program. So that's what I want to say. So Ireland, I saw something from Ireland. I saw something from other countries. Let's continue the conversation. We need to find an accelerator, and then we might be able to slew you in into this program. Does that answer the question, I hope? So this is all from our side. So please, early stage innovators apply by January 5.
Other US states, just to finish that thought, how about other US states?
If they are females, we have the female program open for together with Women in Bio. You don't have to have a Women in Bio member, but we have that is open to across the US. But our mandate for California Life Sciences is to catalyze and accelerate the members in our state. And so for now, we are focusing mostly on California-based companies for this program, for this MedTech. I do not want to go into that. We have a lot of activities planned. So including several events with Resi and Bio next year. I would like to hand it over back to Diane and Ayelet then. Thank you so much. If there are no other questions, or we can have questions at the end.
Interestingly, I am having challenges with my video. Ayelet, can you turn yours on?
Absolutely.
In the meantime, I will start talking. My apologies. But off video, you saw me perhaps at the beginning. Let me talk through briefly through the reason why we exist. Startups fail in a variety of reasons, and that's a really and especially in a complex technology field like ours, that's a challenge. And so we at MedTech Innovator and BioTools Innovator exist to tackle these challenges. I will not go into them. Many of you have seen the stats report, but jumping forward, MedTech Innovator and BioTools Innovator, and we'll speak more to that. BioTools Innovator is powered by MedTech Innovator. We're talking today about the two programs, and we'll go back and forth. MedTech Innovator is the largest life science accelerator in the world, and the programs that we run are open to companies anywhere in the world. There is a separate Asia-Pacific program that we're only briefly touching on today for folks in that part of the world. But to the Europeans I saw in the Q&A and other places, we have plenty of alumni in various parts of the world. So really our stats over the past decade, we're celebrating our 10 years. Our stats over the past decade have been inspiring, at least to me. And we work with the premier industry partners that can help and make a difference for innovators in the field.
Thank you, Dan, and that gives me a great opportunity to talk a little bit about BioTools here. So for BioTools Innovator is the most recently launched program out of MedTech Innovator. If you could just go back to the previous slide, please. Thank you. And so in 2021, we have launched BioTools Innovator to leverage the model that we successfully deploy in MedTech Innovator programs, whether in either Asia Pacific or the US program. And the focus here, and I'm going back a little bit to what Sibylla said in the beginning about the stage of development of startups. So the reason I said we're complementary here is that really we pride ourselves in being an industry-focused accelerator, which means you may see a little bit of a more advanced stage in our companies in the accelerators, and we'll talk about this in details later. But really the goal here is to connect you to our industry partners, which you can see here. BioTools Innovator, as I said, as the most recently launched program, was really built and designed purposely to support innovators, specifically developing products that are life science tools and molecular diagnostics with our two founding partners, Brado Capital Partners and Research Corporation Technologies, RCT. But we definitely didn't stop there. If you could jump to the next slide, we have a growing ecosystem of partners, industry partners, to support that activity and to support the startups in that realm. And we continue to grow it as we speak, so we can continue helping innovators get to market faster and better. If you could skip to the next slide. And so that's a great opportunity to say all of our programs are now accepting applications. As Diane mentioned, we are a global program, and so global organization, sorry, and so you can apply from everywhere in the world. If you're just to touch on our Asia Pacific program, if your market focus is in the APAC market, this is the right program for you if you're focused on the MedTech side of things. And again, we'll talk about this again in a bit. And so all of our applications are now open until January 31st. We, of course, encourage you to go ahead and apply sooner rather than later. So next slide.
I can only go down on what Ayelet just said. Sooner is better than later. And we'll talk a little bit about focus areas. And so MedTech Innovator is specifically in medical device and healthcare IT. And so this is, and here we go, my video works, phenomenal. It's always nicer to look at people. Hello. Medical device and healthcare IT are largely our focus areas. We have a little bit of diagnostic. And so these are stats from previous cohorts, but it gives you a flavor and an idea of what we're talking about. With that, I will hand it straight over to Ayelet for the BioTools Innovator focus areas.
Thank you, Dan. And so again, to kind of complement what we're talking about, this program was really specifically designed to support what we call life science tools and molecular diagnostics. And so what we're looking for are kind of the four main pillars that you can see here. So these are innovators developing technologies with research products and instruments that can be kits, assays, reagents, or instruments that are somewhere in that workflow of R&D and drug discovery or drug delivery. It can be a diagnostics technologies or platforms and biomarker discovery. It can be R&D and manufacturing services. A lot of our BioTools companies are actually starting out more as a service, which will productize a little bit later on, or a different form of early access lab or something similar. And again, we're looking for drug discovery technologies, drug delivery technologies, and biomanufacturing as part of the examples. And I'll talk in the next slide. This is just to give you an idea of what our applications have looked like so far. So these are kind of the market applications that we've seen more often as potential applications for those platform technologies, for these enabling technologies that we are looking for within the BioTools program. Next slide, Diane.
So with that, what are we looking for? And you can see we put both programs on one slide to be able to talk to you about the similarities and the differences, because we recognize that we have an audience that covers both. And while I think about it, talking about our audience, I can see the questions come in Q&A, and we expect to get questions on all three programs, the California Life Science Program, MedTech Innovator, and BioTools Innovator. Keep those questions coming. We will answer some of those in writing, and we will get to some of those live. So keep them coming. We love that. Specifically for people who submit anonymous questions with requests for resources, that's not helpful. We can't send you an answer. So just making sure we got that. But let me get back to expectations. What are we looking at? From MedTech Innovator, we're talking early to mid-stage startups in medical devices and healthcare IT, as I just said. Ayelet, oops, I must have accidentally clicked something. Ayelet just mentioned the BioTools Innovator program is a little bit earlier stage, and it has a broader technology set within BioTools. But the common expectations are you be incorporated at time of accelerator. You have runway to execute on your current milestones. You have prototypes and some sort of proof concept of evidence. We look different in terms of what we expect you, what stage we expect you to be in terms of companies. MedTech Innovator is all the way from seed to Series C. So we have some companies that are way later stage than others, and we hone our program to your needs. BioTools Innovator is earlier than that. And the common expectation here, if you get into the program, we want a senior member of your leadership to be part of the accelerator. This is something, these statistics give you an idea of the development and funding stage. So just to illustrate my previous point on the two programs, that may be a little bit too much information, but I've been getting plenty of questions as in, oh, but we're a Series B, are we too late? Or we are pre-seed, are we too early? I would say largely it depends, of course, but for MedTech Innovator, we usually call ourselves a later stage accelerator. BioTools Innovator is in its third year, and Ayelet will talk more about that as we progress. We just want to make sure we manage your expectations well. What are we looking for from you? We are looking for, we're an accelerator. We are accelerator programs. So we're looking for value. We're looking for signs that you are executing well and that you can continue to execute well and momentum in what you do. None of this is completely new to you, I'm sure. And what do we offer, Ayelet?
Thank you, Dan. So really, let's talk a little bit about how we can support you. I know we already have a few questions in the chat about this. So there are several things that we see as very important as you get accepted to the accelerator. We have an educational curriculum. I know, as Sibylle had mentioned, some of the webinars. So we have industry panels that we hold with our partners and external ecosystem subject matter experts that are there to really support the cohort as we design these panels around the questions coming from our cohorts and the topics and the gaps that we identify during the selection process leading up to the cohort. These are accompanied by office hours and workshops with our service provider partners and other experts that we bring in as needed. So some examples could be, cap table management. Some example could be, Diane, you must have a million examples as you had ran the office hours last year. But anyway, feel free to ask in the Q&A. The other and very important thing is the mentorship. So one of the things we really see as crucial, the early stage companies in MedTech Innovator, as well as all the companies in the BioTools Accelerator, have one-on-one industry mentorship from an industry expert within our network. This is a crucial part of the program and is one that is highly important. I'm sure Patrick can talk about this a little bit more and about his experience later on. Access to resources and funding. So of course, part of the accelerator that we did not talk about is the competition and the access to non-dilutive funding as the grand prize and other prizes that we select for the winner at the end of the program. But outside of that, of course, working with investors, either as part of our panels, either as part of introductions or other activities that we do with investors in our network and other and customers, representations of your customers within our network, and so on and so forth. Another important thing, again, community. So your peer network, other CEOs, other founders within your network that are going through that journey. We cannot emphasize enough the importance of having that support network. And that is something we definitely stress as one of the most important things to go through in that program and develop your network further. And of course, the recognition and visibility, whether in conferences, in other events, as Sibylle, for example, mentioned the JPM week and so on and so forth. And we'll talk a little bit more in detail about this later. A quick reminder, we are a nonprofit, so that means no equity or participation fee. And like we said, we are a global program. Next slide, please. So how do we get there? So to be selected for one of our programs, and I should say the application process is separate. You submit an application to either MedTech or BioTools Innovator. You can, in some cases apply for both, but you'd have to apply separately depending on the technology. So just in terms of the process and what that looks like, we get around 1,300 applications a year. Out of them, roughly 250 companies will get invited. The top scoring companies online from our reviewers will get invited to pitch in person in what we call the road tour. So this is a series of in-person pitch events. You'll see some pictures later. And these are very important in the selection process, but also, and most importantly, very important to the founders, because these are very feedback heavy and designed to provide feedback to the companies that are participating. Out of these, we have about 50 companies plus minus in the MedTech program every year, and between 15 and 20 companies accepted into the BioTools Accelerator, hopefully 20 this year. Some of them are early stage, some of them are mid stage. Mostly again in the BioTools program, focused on earlier stage. We have 5 finalists in each program and then 1 grand prize winner in each program in our finale, and other prizes as well that we didn't mention here. So the next slide is just to give you an idea of what that looks like in terms of timeline. One of the things to note are our pitch events. So look at the road tour here that I'm pointing to. This will show you when we hold our pitch events. You'll get invited to a pitch event. If selected, you'll get invited to a pitch event based on your location or the preference that you mentioned in your application. We also have a summit that we'll talk about in a couple of slides. That is a joint event for all of our program, a very important milestone in the program. Our virtual program runs between June and October once you're accepted to the accelerator. And our finals competition for BioTools, it is October 12th, but for MedTech, it is a little bit later in October. Next slide.
Oops, I seem to jump too fast. So let's talk a little bit about the road tour. And the road tour is shared between both programs. And so this is when we get to meet you in person. And in all the conversations I've had with applicant companies, I've always said just like when you're looking for a job, your resume is supposed to get you the interview, not necessarily the job. By the same token, your application is to get you to a virtual or in-person pitching event where you meet a lot of our judges. And that's really what it should be. And so just as Ayelet explained, out of the in-person or virtual pitching events, we choose the participants of the accelerator programs. In June, as Ayelet mentioned, we kick off the program. The programs run June through October. And so we do a combined summit where we really get you all in a room with your fellow CEOs or senior leadership and alumni so that you can learn from each other, get to meet your mentors, learn some of the basic principles. Not a lot of things beat in person attending a conference. And then we have showcases. So I'm showing you last year's one in Boston. Really, we get you on stage, and that is a critical component not to be underestimated. You are thought leaders, and getting you on stage as thought leaders in front of an audience is one of the perks that I hadn't fully appreciated before seeing it in person. And then finals. The finalists really get on stage at a big national conference in front of really what I consider a global audience. So it's a unique thing when you're part of it, and I hope to see you all. But Ayelet, the capstone event for BioTools is slightly different. Tell us more.
Thank you, Diane. So the capstone event for BioTools, again, since naturally, because the focus of the program is different, we also hold our finals event at the meeting on the Mesa, the Cell and Gene Therapy meeting on the Mesa in Carlsbad in October. So that's a fantastic opportunity since almost 50% of our companies really directly align with cell and gene therapy, and even the ones that are not, the attendees in this conference is really a good opportunity, a fantastic visibility opportunity for our companies. And so we hold our finals in October. These are just pictures from our first and second event. Our partners there are Thermo Fisher, designing this event with us, and it's just a fantastic visibility option, as I said, and of course the excitement of choosing the winner. I'll just for flavor, I will add that in our first year, because of some of the questions in the chat, so I'll address it here through this. Our inaugural year winner was actually a pre-seed company, bootstrap, no money in the bank, just received our prize as their first real money. Our second year is actually a company with no equity funding, but with multiple SBIR grants, self-funded, products on the market, very advanced. And so really, there's a spectrum there. If your technology fits within that right scope, I advise either reach out to us directly to ask if this is a good fit. Our kind of rule of thumb is under Series B, under 10 million in equity raised for the BioTools program. And so feel free to reach out with questions or just apply and we'll look at it and let you know. But this is our capstone event. So you can jump to the next slide. Go ahead.
It's my pleasure to ask Patrick, who is a MedTech Innovator 2022 alum and very engaged cohort member, to let him weigh in on his experience as being part of the MedTech Innovator Accelerator program this year.
Well, thank you, Diane, and thank you for inviting me. I'm Patrick Schmidle, and I'm the founder and CEO of Kerry Health. The problem that we're solving is medication adherence, and so we're developing a remote wearable medication monitor. So it's basically the size of a quarter. It's comparable to an Abbott Libre, if you will. It has tiny little needles on the bottom of the monitor, and that detects. But instead of monitoring glucose, we're monitoring medication levels right underneath the skin in the interstitial fluid. And the first medication actually that we're focused on is an opioid addiction treatment because I had a close family member that struggled with opioids. So that's what inspired me to start the company. Even though our solution is flexible, we are focused on monitoring methadone. The reason for that is because methadone patients have to go to the clinic every day to prove compliance. With our monitor, they can prove compliance without having to go to the clinic every day. So it's life-changing. So whenever you have a medical device, you want to make sure that it has a big impact. In our case, that's the case. Let me talk a little bit about where we were before we started the MTI program. So we're at the seed stage now. At the time of when we got admitted to the program, we had not raised a single dime of private funding. We were grant funded. We had received quite a bit of non-dilutive SBIR funding, but we had pivoted a few times. So we're one of the probably earliest companies in terms of where we were from a product development perspective. So for us, the program was incredible. It was fantastic. And while there are many benefits, there are sort of three that I want to highlight, and then I'm happy to kind of open it up for questions. But the first benefit clearly was it gave us confidence, it gave us credibility, it gave us visibility, and essentially from the time that we started the program till now, we raised a $2.25 million seed round. So if you take out everything else, just that in and of itself was worth the program. So the second component of it was that we gained access to an awesome ecosystem. It's just unbelievable, the quality of companies and the quality of people that are part of that ecosystem. It's inspiring. I kind of compare it to, I don't know if any of you follow college football, but the best college football players, every year they get together at a combine, right? And each of them think that they're the best thing since sliced bread. And as a CEO that gets selected, typically you're a standout in whatever region that you're in. But then you get to MTI and you realize that They're unbelievable companies. They're unbelievable CEOs, and they just inspire you to be better, and you can learn from them. So, but other aspects that were very helpful for us is to gain access to folks from the FDA, from CMS. So those are high-level, senior-level folks that were at various conferences and events that we would have never gotten access to if it weren't for MTI. And then the third component that was a highlight was just getting connected to the other CEOs. It's an incredible ecosystem. There are some incredible leaders that I've met and that I'm still learning from, and I'll probably be connected to them for the rest of my career. So those are the three things: credibility, visibility, confidence, access to the ecosystem, and then the relationships with the CEOs. So, and with that, I'm happy to open it up to questions. If you're thinking about applying, you haven't yet, start now. It's for us, it was game changing, and I would say that probably for most companies that went through it, they would say the same thing.
Really appreciate you coming in to give a first person account of this, Patrick. Thank you. I'm going to hand it over to Ayelet to talk next steps before we open it up in general for question. I've seen some come in. I've typed some answers to some of them. If there are questions for Patrick directly or for Wesley, they join to answer your questions. So make sure you type that into the question. And with that, Ayelet.
Thank you, Diane. And I can just strengthen what Diane said here. Use that opportunity of having Wesley and Patrick here. Feel free to start typing your questions for them. So this is just how to apply. So some of the questions coming in were also about this, how to apply. So for the MedTech program, if you go to medtechinnovator.org/apply, this is the apply page for the MedTech program. For BioTools, similarly, BioToolsInnovator.org. and apply. It will take you to that same login page to create your user and start your application. And we also have a QR code here to get you directly to that page. It will ask you, and once you created a user, you can choose the program you're applying to and start filling out that application. So as simple as that. And I will, with that, I think let's get to the questions because this is really the important part. And so let me jump real quick into one of the questions here just to make sure that we're not confusing the programs because I see one question coming in about this. So the BioTools and MedTech programs, these are not specific to female founders, even though we do pride ourselves with, in the BioTools program last year, we had 40% female founders. So we do pride ourselves with this, but this is not limited to female founders and not to California or the United States. Both MedTech and BioTools Innovator are global, and you don't have to be a female to apply. So this would answer, I think, this. For Sibylla's program, I'll let you again reiterate that point about international companies.
So our main focus in the FAST California program is really on the different California innovation hubs. So that's Bay Area. 80% of our advisors and investors are in the Bay Area. So it's for Southern California also to have access to that. Of course, the Orange County, LA area and everywhere else. And the international part is we usually work with governments and accelerators internationally. We might change that and reconsider that later on in 2023, but for right now, that is our rule, because we also have limited capacities and it's usually below 5 million. So somebody had said, is there some criteria to apply? Yes, below 5 million of investment and below 12 employees. So definitely in a Series A, you might be above that amount. And that's where you're better at MedTech Innovator. Does that answer the question?
I'm going to jump in
I
and
believe
ask
so.
Somebody asked about specific criteria. I feel you just mentioned those. Are there any other specific criteria you would like to mention?
We like to focus on first-time founders versus serial entrepreneurs, and high medical need, really disruptive innovation. So Wesley definitely fits that category, and diversity in founders. So we like underrepresented founders as well.
All right, thank you.
Sibylla, one quick question here that I would like to address, because I guess it pertains to all programs. Does either program accept combination of drug device system? I'll let you start.
Yes, we do. We have, because our strong part is therapeutics, so we understand this in between very well. But again, it's below 5 million funding and smaller companies. Yes, we like drug device combination.
Fantastic, thank you. And Diane?
I'll jump in real quick, just in answer to some of the questions that I've seen. One of the good ways to get a little bit of information on who are the companies that went through MedTech Innovator or BioTools Innovator in the past is to look at the portfolio pages on our website. So it gives you a flavor of who has been part of the program in the past and are we similar or not. And secondly, we encourage all of our companies. We actually have a competition for best 1-minute video. And so you can see 1-minute videos of past companies, and that will give you a strong flavor. And so very specifically, I just saw a question as in, do we have mentors on our teams that can help with business guidance on orthopedic devices? The short answer is, heck yes, look at our partners and look at the companies who have gone through MedTech Innovator. Absolutely. But more broadly than that, review past companies, see the similarities, feel free to send us questions. We want you to be successful. That's why we exist.
I'm going to address one other question here that I think is important specifically about diagnostics. So it is a great question, which program you fit in. Some of the diagnostics will fit better under MedTech Innovator. Some of the diagnostic technologies would be under BioTools. My advice when it comes to this, please email either me or Diane or both. It's Ayelet or Diane at medtechinnovator.org with a brief explanation of the technology and a link to your website. We'll get back to you with which program is the most appropriate. It really depends on what kind of support you would need to get to market, and hence which partners in which program can be the right support for you. And so there are other criteria, of course, but please email us to ask the question. If it is not a straightforward device that is used for diagnostics, please email us and we're happy to direct you further.
And I have just parked in the chat for those who are live with us, YouTube/MedTech Innovator channel is where you can find a lot of these videos, as well as some of the content from our webinars. Perhaps I'll jump in on one question that Deidre asked in the chat. And I think there is still some need to disambiguate for what programs are available only to female founders, what programs aren't. Really, all 3 programs we're talking about, all 3 programs you see on the slide, and I'll actually stop the screen share so that you can just look at our friendly faces. All 3 programs are open to male and female founders, but we pride ourselves, all 3 organizations and all 3 programs, on our support for diverse founders. And so I will make a personal note to show our diversity stats in the next webinar. Sibylla did that in her portion. So basically, we want to help great startups. And we pride ourselves on the fact that we help great startups regardless of what you look like.
I apologize that I might have confused with mentioning the WIP Fast program, but we have a specific female track, and that opens up to all of the US. And that was a question, and that's why I mentioned it. Sorry.
Not at
Diane,
all.
one
And
thing.
perhaps to double down one more on BioTools. BioTools is not pharma. I am going to say, if there's one thing that neither MedTech Innovator nor BioTools is, we're not pharma. If you are making a therapeutic, you are you are better served with California Life Sciences than you are with MedTech Innovator or BioTools. And I see that Patrick just raised his hand. Patrick, go ahead.
Yeah, I just wanted to mention one question that that would be good to ask is, how do you stand out, right? If there's 1,000 applications, your goal is always to kind of get to the next step, right? If you send in your application, you want to get invited to the live pitch. When you get to the live pitch, you want to get selected for the program. So how do you stand out? So a couple of things that I would recommend is that you get as many recommendations as possible. So not just from founders that have gone through the program, but there are also service providers that have an opportunity to submit recommendations. So my strategy was to, I think I got 3 or 4 different organizations to recommend our company. And so that helped us kind of stand out. So by the time we got there, there was already some kind of a recognition. And then maybe later on, if there's some questions of how do you stand out at the live pitch, I'm happy to answer that question as well.
That's excellent. Appreciate that.
I'm going to address the quick question here about plastic surgery. So plastic surgery, sorry, if your technology is within that track, this is a track under our MedTech program. So all you need to do is apply to the MedTech program and we will direct you to the right track. But you will be part of the overall cohort, just as a clarification. Let's see. Okay.
Sibyl, there's a question
ahead.
for Sibyl in the chat. Does California also accept companies doing digital health in diagnostics and therapeutics? And you're on mute, but you're nodding. And so that means yes. Farzad, please
We
apply.
love diagnostics, IVD diagnostics. We have very specific, and my background is Roche Diagnostics, Boehringer Mannheim. So I love the intersection therapeutic diagnostic. Yeah.
Very good. Thank you, everybody, for all the questions. I just saw the question. How many recommendations are needed? I would say it's just like with a job interview or something else, more or better, but practically good ones over quantity.
And just to clarify on that, you don't have to have a nomination, a formal nomination or a recommendation. It obviously helps, but you don't have to have it. If the technology is aligns with the strategic interest, if the team is at the right place and the right time to execute on the product, we have an excellent track record of recognizing that. So fear not.
I am going to ask you, Bill, to post the link for applying to CLS in the chat to everyone. That'd be helpful.
And while you do this, thank you, Diane. And there's a general question: can you apply to 2 programs? The general answer is yes, indeed. I'm not sure if you meant MedTech and BioTool or FAST program and other, but I think in general, the answer would be yes. It's more about having the bandwidth and the resources to execute on what you're doing in the program and your work with the mentors, which is very important. So just make sure you have the bandwidth to do so. if we have a question on which track we fit in, can we email you? Yes. So this is really important. I have responded to some people privately. Please do email us with questions. You can email either me, Ayelet, Ayelet, at medtechinnovator.org, or Diane, which is a little bit more straightforward, at medtechinnovator.org. Feel free to do so. And then Sibylla, do you want to give the best contact email for the FAST program?
I've got it covered. She chat sent it to just me, and I will copy paste the link into the general chat. There. Here it is.
We should have had that on our slide deck. I admit it. Yes. And the email contact is on that link.
Very good.
We hope many apply to all the programs. We want to see really great technologies. And we also, by the way, invite our FAST alumni to help us review the applications and also to reach back out. So Wesley, for example, has consulted one of our Japanese. So we are building the community, and we might even cross-build it with MedTech Innovator and BioTools Innovators. So we enlarge our communities now even more. Mm-hmm.
And of course, we're hosting these events in common because we are not only not fighting or competing, but we are collaborating. We share a mission. We're trying to make you successful. So do apply to the programs that pertain to you and others. I know that at least in MedTech Innovator, we have plenty of folks who have previously gone through Y Combinator or TechStars or M2D2, because we are a later stage accelerator, it is not a surprise that we catch folks who have already gone through an accelerator. Ayelet's BioTools Innovator program is a little earlier stage, and so she has some people who are earlier stage and have not gone through other accelerators.
Absolutely. With that, again, my strongest recommendation, and Diane had mentioned this before, go to our portfolio pages. You will see some of the companies in BioTools and MedTech that specifically have gone through some of the accelerators Diane mentioned. It is actually becoming more and more common for early stage startups to participate in multiple programs. I think it's synergistic. I think, as long as you have the bandwidth to do so, I think this is very helpful and a smart use of your resources and time. So.
Yeah, and I'll second that. Coming from the Biodesign Fellowship to California Life Sciences, it's really about where you start and where you're trying to get to. And each one of these is kind of a stepping stone to really the ultimate goal of launching your company, getting commercial, and you'll need all the resources and network you can get.
I know Patrick has to jump off, so just wanted to recognize that and thank you, Patrick, for being here. We can stay on for a few more minutes. I see folks still have questions, so feel free if you have last-minute questions. If not, again, feel free to reach out to us. But thank you so much, Patrick, for being here. We really appreciate your time and that wonderful testimonial.
Well, thank you for having me. And if any of you have questions, reach out via LinkedIn. Happy to help. So, and thank you for having us or me.
Thank you. We'll see you soon, Patrick.
Yeah, talk to you soon. Bye-bye.
I just saw a question that asked to reiterate. The FAST application is January 5th. Is that correct, Sibyl?
Yes.
All right. So folks, get your applications in for FAST now. MedTech Innovator and BioTools Innovator is January 31st, but now is good because they do get reviewed.
Now it's better.
Earlier applications get reviewed earlier.
Makes a good impression not to be last minute.
Exactly right.
Absolutely.
All right.
And the earlier, just practically speaking, the earlier you apply, the more eyes you'll have on your application from reviewers. So just from that technical standpoint, you definitely want to apply earlier and increase your chances of getting into either program. I'm sure I speak for all of us. There's a question here. Oh, sorry. I think maybe Diane has answered this question in the chat. So great. I think,
So I believe that the
Sibylla, you
fast
have
track for
answered
female
this one.
founders is
Okay,
open
great.
to non-US companies. Am I correct? I think that is what you said, Sibyl. Fast track female founders open to non-US companies.
Yes, we will have one slot open, so it's very competitive, and we will open up one slot. That's right. That audience member maybe knows about it for one international company, because we collaborate with Global Invest, which is also connected with Golden Seeds.
Got it. We are right on time. And so I want to make sure we'll follow up with a couple of questions that were that I am simply unsure about, but we appreciate everybody's time. I am so glad that we were able to host this webinar together. And so thank you, Sibylle and California Life Sciences, for joining us for this. Thank you, Wesley, for providing some tangible advice and some tangible feedback directly on the program. In absentia, thank you, Patrick. And we wish all of you a very wonderful end of year and a happy 2023. Onwards to more success. Thank you, everyone.
And more funding.
Thank you, everyone. More funding to all. All right. Thank you, everyone.
Okay. Bye.
Bye.
Have a great rest of your day.